inviting me for this very talk on the platform, and I'm very much thankful to you all. So I will begin with the talk, and it is a topic on the Parkinson's disease and the impact, recent advances and the impact of artificial intelligence. As you all know that Parkinson's is a disease of brain, and due to the disorder in the brain, there is a difficulty in walking, difficulty with movement, and that's why it is also known as movement disorder. And there is problem in balance and coordination as well. So apart from this, there are some signs of mental and behavioral changes. Sleep problem is there, depression is there, memory difficulty is there, and fatigueness is there. So patient do tend to become more fatigued as the muscle work is very, the thirst of the muscle, threshold of the muscle work is very high. That's why the patient becomes very fatigued. So if you will see the gender wise, then we can see that men and women both can have Parkinson's, but men are 50% more than women, because it is due to the hormonal factor, and it has been seen in any many other conditions also, that the prevalence of any condition is more in men rather than women, and it is due to the hormonal factor and the estrogens. It is known to be disease of elderly. Parkinson is known as a disease of elderly, and the onset of the disease is from 60 years, and the percentage is that 90 to 95% of the subject is having above the 60 years. There are early onset of the Parkinson's also, and this early onset, you can say that 5 to 10% belong to the early onset, and nowadays 1 to 2% is in juvenile Parkinson's also. Early onset of the Parkinson's is not related to any genetic or inheritance, but it has been linked to the specific gene mutation. As pathophysiology, many of us know that it is due to the decrease in the level of the dopamine, and the dopamine decreases because the part of a brainstem known as substantia nigra doesn't produce those dopamine, and dopamine works at the neuronal level and combines with the acetylcholine to coordinate our movement. The Lewy bodies are formed. Lewy bodies are a type of protein which do attack the substantia nigra brainstem. Then we will have the movement disorder. Sometimes it attacks the cortex level, so you will have the cognition problem also. Sometimes at the medulla level. So medulla level, then non-motor functions are affected, such as this patient may have complained that he is not able to smell, or any other sleep problem he may come with that complaint. So there are cardinal signs in can easily find out that subject may have the Parkinson's disease, such as bradykinesia, that is the slowness of the movement, muscular rigidity, the tightness or the flexibility of both sides of the muscles, that is the extensor and flexor group, is very resistive, hence the rigidity is there. Then tremor is one of the classical sign in the Parkinson's. The subject will be having tremors in the upper limb and the lower limb, sometimes over the face also. So these tremors identify that the subject may be having the Parkinson's disease. Then later on, as this disease progresses, there is a postural instability, and as per these stages, we will come to later on to the stage, and as per the stages, there are postural instability in the subject. And other symptoms also are there, like emotional changes, difficulty in swallowing due to the rigidity in the muscles, chewing, speaking is there. You will see that when you will talk to the person of Parkinson's disease, then they will be having a very slow voice. They will be speaking in a very slow voice. Then urination problem is there. They may complain of frequent urination or incontinence. Constipation is there. Skin problem is there. And gait, as you know, that it is suffer and slow and stoop gait. This is also one of the classical sign in Parkinson's. And at the stage level of 2 or 3, you will see the such type of gait. So there are a progression in the Parkinson, as you all know, that it is a progressive disease, and progression is not as such that two patients are suffering from the same length duration of Parkinson's, but their level of progression and the other patient level of progression may differ. Suppose the subject may be having 3 months duration of the um, Parkinson's and he is having tremor, other may be having very mild tremor, unnoticeable tremor also. So the progression will delay and it is totally subjective. In case of you can ask the subject to write and writing will be slow. Friends and family members may notice these things, that he is having slowness in the movement, he is not able to write properly, his hands are not so much functional as it used to be earlier. So it is first noticed by the close associate of the subject who is suffering from Parkinson's. The person face is also one of the indicator. Is the one indicator means that the face is mask-like. The mask-like face is the one of the indicator for the Parkinson's disease. And if you see the symptoms progression, then it is start from one side of the body and then may go to the other side of the body, and the symptoms of one side or other side may be differ, means in terms of tremor, in terms of movement, in terms of any performing ADL, the symptoms may be differing from both the sides. So many people who are having early symptoms, prior to the tremor and the stiffness, they may complain of sleep disorder, constipation, decreased ability to smell, restless syndrome, leg syndrome, and defining these things and taking picture or account into these things, the progression stage has been defined, and it has been differentiated into 5 stages as on the basis of the function of the subject. For once stage 1, you can say that there will be symptoms, but his performing any task or any activity will be very independent, and it will not interfere into his daily activities or daily living. So tremors or other movements will be there. There will be some changes in walking, facial expression, but it is not going to hinder his independency, or you can say that he is able to perform his task very smoothly, though there may be increase in the length of duration of performing that task, but he can do that task very smoothly. Then stage 2, here the symptoms get more worse, means here he will be able to also perform the task, but the time duration or the initiation to do that task will be much more. Suppose he is able to stand from the chair within 10 seconds, then here in second stage, normally one people 5 to 10 seconds takes to stand from the chair, but in stage 1 he may take 15 to 20 seconds. In stage 2 it may be more than 40 seconds or 50 seconds. Though here also he will be doing the task, performing the activity, but the duration and length will be much higher. And looking into his capacity to do the functional activity, we can suggest that the subject has stage 2 type of Parkinson's. Then in stage 3, what happens that here this considered as a mid stage. Here the length of duration of performing any task has increased significantly, means it will take 2 minutes to stand or sit. So it has increased significantly, and performing every task will be very slow, very slow. And from stage 3, one thing important is that postural instability is vigilant, and due to this the fall is common. So stage 3 we can also identify with the postural instability as well as length of duration of performing the task. He can do here also independently, but there will be significant increase in length of performing any task. So stage 4, it limits the activity. Here what will happen that the subject will need partial assistance to perform his task. Suppose walking, so he will be not able to walk independently, but he will need some assistance such as walker and all that, or any help to walk. Or with the walker he will be able to walk on his own, but without walker he will not be able to walk. So some type of assistance he will need to perform the task. So here you can say the subject is able to perform the task but not independently. That's why this can be considered as stage 4. And in the stage 5, what happens that the patient becomes very dependent, and he needs all the time assistance, and without assistance he cannot do any of the activity. Means he needs full assistance, means everything is to be done by some other person who is nursing the subject. So this is stage 5. So these are the 5 stages where we can define the rate of progression of the Parkinson's, and this will also give you a clear picture that what type of treatment also you can plan looking after the stages of the Parkinson's. Whereas in stage 1, stage 2 till 3, physiotherapy helps a lot, but stage 4 and 5 we need to do some surgical process also, and with medicine then we can do the treatment. Because what happens that freezing of the movement starts in after 3. In stage 3 also is there freezing, but 4 and 5, in that condition freezing is very common. So there we have seen that these are the motor symptoms, and there are non-motor symptoms, or you can say non-motor function also, to identify the Parkinson's. So non-motor symptoms are also there, and these do consider of these things, that there will be changes in the cognitive behavior, constipation will be there, early feeling or fullness of the stomach, while they will, due to this he will be having very small meal, he or she, excessive sweating will be there, fatigueness will be there, loss of smell and the taste will be there, mood disorder, depression, anxiety and irritability will be there, sleep disorder will be there, sexual disorder, frequent urgency of urine or incontinence, vision problem, weight loss. These things are the non-motor functions. Early we know that it is a movement disorder, but these non-motor functions are the early sign of Parkinson's. If anybody near to him can elicit that these things are happening in the subject, then we can come to know that the person or the subject may be progressing towards the Parkinson. Any other problem may be there. In dementia also this happens, in Parkinsonism also. Parkinson is different and Parkinsonism is different, but symptoms may be there, non-motor, but it can be differentiated later on, but it is a sign that may be progressing towards the Parkinson's. And there is a scale also defined to defined to have the functional outcome. That scale is known as Unified Parkinson's Disease Rating Score, and this scale is very much useful in doing the research activity of the Parkinson's patient. So it has been defined into 5 parts, and the description is on the basis of 0, 1, 2, 3, 4. 0, where a person is able to perform any task. It may be mental task, it may be any activity of daily living, it may be any type of gait and anything. Whatever task is there, it has to, there are certain categories which has been divided through this. It is a very lengthy thing, and it has been decided according to that. So if the subject is able to perform the task, it is scored 0, and it is normal. When there is some difficulty, means their length of time duration is higher, then it is or it had given the score of 2. So in 1, in 2 there is moderate impairments, he is having some difficulty and he is fatigue or arrest of the movement, then the score is given 2. Severely impaired means he needs assistance to perform any task and he has a very problem in initiating the movement, then you can score that as a 3. And in 4, he is not able to perform any of the tasks. So you can say that stage 5 will be the 4 score for the subject of Parkinson's, and this is known as Unified Parkinson's Disease Rating Scale. So what is this? UPDRS is a compressive tool to account for the non-motor function as well as mental behavior and mood. In this, non-motor functions as well as the motor functions, both are being examined and scored, and total score of both non-motor and motor function goes up to the level of 199. And if one is scoring 199, that is means that this 199 scores that he is having higher level of the disability. Lesser the score, more will be the functional outcome of the subject. So there is a theory of progression, and which was given by the Bachs, and it usually based on the non-motor functions. And Bach said that that Lewy body is actually having the impact over the medulla, then the olfactory bulb and control, which control this sense of smell. And due to this, what happens that when this person complains of first sign of smell, then slowly and gradually that Lewy bodies progress to the substantia nigra, or you can say the midbrain, then he will be having the problem of the movement, and sometimes over the cortex, then cognition will be also there, and other symptoms like sleep disorder, constipation also may be. So this was the theory of progression, that it progresses how it may first come to the medulla, then to the midbrain, and then the cortex level, and then accordingly the symptoms will occur, and the progression will be also defined according to the occurring symptoms. So these are the symptoms. 10 signs are there. You all know: tremor, small handwriting, loss of smell, trouble sleeping, moving, walking, constipation, low voice, mass face, dizziness, fainting. Stoop posture is also one of the feature of the Parkinson's. So in physiotherapy management, we first, according to the stages, we can ask the subject to do. First, we will ask the subject to perform any simple task, walk, then ask him to do complex activity by walking or object. So we will progressing to complex activity. And is that we work on the basic flexibility of the muscle. Of the muscle the and then for the connection we will have to work on the breathing exercises for this to be done. Of the muscle, as well as coordination, as well as use the relaxation technique for the treatment of Parkinson's disease. So, and medical management. One part is the the task easily, but during that DBS physiotherapy is very important, because to maintain the flexibility of the muscle, physiotherapy should be done regularly to have the better functional outcome with the subject who has undergone the DBS. So physiotherapy management, as early as the patient is diagnosed, musculoskeletal flexibility has to be maintained. Thoracic expansion is important, because what happens as the patient stoops, his diaphragm doesn't work properly, the vital capacity of lungs decreases drastically, so it may lead to some respiratory distress. For that, thoracic expansion is needed. Of the Parkinson. To prevent contraction deformity, the complications in the subject of the Parkinson's disease. So we have to do physiotherapy to maintain the mobility, strength, capacity, which ultimately leads to good quality of life of the subject. This is a progressive disease. The progression will be there, but as the progression will decrease, they will have type of artificial intelligence. So we can say that it is a device that it perceives its environment and takes action and maximize its chance of successfully achieving its goal. A more elaborate definition of the AI can be a system ability to correctly interpret the external data, to learn from such data, and to use those training to achieve specific goal and task through flexible adaptation. So you can say that it is a robot thing where the things are already through software it is made, and it is interpreted by the activity of the external activity and through sensors, and it works on that. And how this artificial intelligence helps in Parkinson disease, for that we can take into the account of all the tests which is there, that is the work balance test, UPDRS scale, time up and go test, that is the tug test. Suppose you are taking a tug test. So a normal general person, what happens, that if you will ask him to stand from the chair, walk for the 3 meters and come back to the chair, he will take around 10 seconds of the time. This is the normal. So in Parkinson, the length is increased. He may take 20, 25, depending upon the stages. So here we giving the artificial intelligence treatment, and post artificial treatment, we can do the assessment, and this will also say that how much it is helpful in treating the subject of the Parkinson disease. So these are the scales and the assessment tool which can say that in Parkinson's disease the artificial intelligence is helpful. So how it works, here you can see a figure, marking is there 1 2 3 4. So one is the say 6 by 10 foot speed matching treadmill. It is a treadmill, and then 3 by 8 of the foot rear projection. It is a projection is there. So these surfaces are coming towards me and I have to walk accordingly. This will improve the coordination. And he has been harnessed also because postural instability is there. So first with the harness he will be walking, and then later on the harness will be removed and he will be made to walk without the harness, so that we can see that how the stability has improved, how his complexity of the activity, so simple to complex activity will be done. And this I will show you through a video. This will clear the picture that how it is.
Williams is buckled up and ready for action. It looks and feels like she's part of a video game, but it's actually high-tech rehab for her Parkinson's disease.
We know in neurorehabilitation, you have to challenge patients for them to get better. And so this provides a very safe environment for that to occur.
The virtual reality treadmill has
It's not visible, sir.
And a base that moves to mimic different surfaces. It can also react and adjust to a patient's movement, and a wraparound video screen completely immerses the patient into life scenario.
Going over like a little hill, you feel it through the machine.
Rather than just having the patient walk or an individual walk up and down a standard biomechanical track, now what we can do is we can change the environment in a very dynamic fashion.
Special programs are designed to work on specific skill sets while providing positive feedback. During weekly appointments at Cleveland Clinic, Sandy works with her therapist on gait and increasing stride length by touching her toe to a box. Other times, she's asked to target birds and butterflies while walking. This helps with balance, and it satisfies that competitive spirit.
I enjoy doing the birds and the butterflies and swatting them down, killing them. Not that I enjoy the killing part, but I do enjoy the challenges. Can I get them? I know once I slow down, it becomes a point where I couldn't move. I do whatever I can to keep myself going.
At Cleveland Clinic, I'm Erica Foreman.
So here we saw that how she was walking with the harness first, and she was able to walk nicely, and then later on the harness was removed. She was able to do the dual task also, that she was hitting the bird and she was scoring also. So this was also motivating her that how to do the functional activity. So this was the way she improved her stability also, and that was coordination also was improved, and you saw that the stride length and all that also improved in the meantime after giving some amount of treatment to the subject. So and this happens why? Because repetitive practice is being done, and as we know that neuroplasticity works. Earlier our guest was talking on neuroplasticity, and I think that he has covered those things, that how it works and all that. So that is the concept which also works here, that practice and repetition leads to the improvement in the function of the subject. So another video is there, that how the artificial intelligence works. What are the system or technology behind that? So we will see that how it works.
The more I exercise, the better I feel.
Hello, Dr. Ranjan, sir.
Yes.
Your video is not visible, sir. Only background music is audible. Your only background music is audible. Video is not visible.
Just a minute.
The therapeutic gains are the result of a marriage between the I need a rock solid north. That's a mega topic.
These three technologies enable smart devices to do this. To make the technology more accurate, the developers created suits with 9 built-in sensors.
They were a big thing.
The battery-operated suits were awkward and cumbersome, so the developers turned to camera technology.
It's bathing you in infrared light and then taking that information and using some very clever software to say, you just raised your hand.
The camera technology does not need to be worn, but it's not as accurate as the sensors.
Each one has their pluses and minuses, and we're looking at actually trying to perform a fusion between those different technologies.
The UCSF study showed that despite their physical limitations, Parkinson's patients could successfully play the games at home, and they did them more often because they enjoyed them and they helped.
It was a fun way and an easy way to exercise right in my own front room at any time. I felt better. I felt more normal, more fluid, looser.
In fact,
there is accelerometer, gyrometer, magnetometer, and earlier you saw that there was a the sensors were of wired, but later on those sensors were replaced with the laser sensors so that the precise movement can be elicited, and accordingly that precise movement, the precise type of treatment should be given, and there will be good functional outcome in the subject. So we can have seen this, that how it works, virtual reality works for the treatment of the subject, and now we can see that lot of devices has come. This is the number, you will see the picture number A, where it is put on the hand, and what it does, it elicits the tremor for 1 minute. How much tremors is happening in the hand, that can be elicited, and this will be very much helpful in getting the proper precise treatment for the subject. So these type of things are coming up here on the lower limb. It is being attached to know that how much time he takes to initiate the movement, what is the how much slow movement he is doing from the normal subject. So these things are based on artificial intelligence, and this is going to give us a good accurate data, and will also help us in doing our research for the benefit of the society. So these things are there, and artificial intelligence are going to play a major role in the research activity as well as the therapeutic aspect. So in coming years, advancement of technology, measuring of Parkinson's disease and rehabilitation will grow significantly for better outcome and for good active quality of life. And now we are saying that in this hard time of COVID, we are also using the e-technology a lot for our education purpose and all that. So later on, I think this type of transformation will be there in the medical field also, and telemedicine, e-health and everything will be there. And we will have to also be updated so that we should be using for our practice effectively. Thank you, everybody. Thanks for listening and bearing some of the technical fault. I'm very much thankful. Any query is there, then one can ask me.